We'll go ahead and get started. Today is the long-awaited final webinar in our three-part series about effectively enforcing smoke-free policies. I'm Sophia Yelkin with Lincoln Lancaster County Health Department and Tobacco-Free Lancaster County, and we are excited to welcome you. Let me go ahead and introduce our featured panelists. We once again have Shar Day from the Americans for Non-Smokers' Rights Foundation, Jeff Sokup with Tobacco-Free Nebraska, and Susan Tatum with Lincoln Housing Authority. So Shar, take us away.
Thank you, Sophia. Oh, it's great to be with you on this very cold day, right? I'm just all bundled up for it. But hey, before we jump into how to ensure effective compliance of your smoke-free multi-unit housing policy, let's take a step back and talk about what happens before the effective date. So what we want to have happen, say 60 days before you go smoke-free, is to have all of your residents sign a lease addendum. And it's really useful to notify folks in writing that they need to sign this, and then schedule appointments to have them sign that lease addendum. Also, super helpful is to post no smoking signs inside the buildings and at doorways, in the entryways, and any other kind of prominent place. But it's really helpful to have those signs in all the needed languages. And I'd love to pass it back over to Sadie, I believe, who has an example of, oh, Shelby has our example. There she is.
And so here at the health department, we do have like door hangers that you can hang on residence doors or at the doors to the entrance to the housing unit. The ones we have here does have English and then Spanish on the back.
Which is so great.
Yeah, and then we also have window clings that are available. And then if you do have other languages needed, we would be happy to accommodate that as well through our resources we have here.
That's wonderful. That's a great resource, Shelby. Thank you so much.
Absolutely.
And maybe we could put your email address in the chat box where folks can easily connect up with you.
Absolutely.
So again, these signs are awesome. And here's one in Spanish right there. Absolutely perfect. So now we're talking about
Shar, let me just jump in and add something real quick for those that have properties that are outside of Lancaster County. Just know that those same signs, those same door hangers, any of the window clings, all the things that you see that the county health department is talking about here today are also available statewide. So if you contact Shelby about that and you have a property that's outside of Lancaster County, she'll know to contact us and we can get those out to you for free as well. So just so that you all know that if you have those properties across Nebraska, there are resources for you as well outside of the county. I've even been sweet talked into sending them to properties out of state. So just so you know.
That's awesome, Jeff. Thank you so much. I mean, what a great resource. What a fabulous resource to be able to tap into. So now we've got our date and it's time to implement our policy. So this is where it's really helpful to set the stage and make it wonderful. You know, send a reminder to your residents a week before that the date's coming up, or the day before. Let's say it's on Valentine's Day, send it a week before Valentine's Day and then the day before, and then hold some kind of coordination meeting with the staff so that everybody is well prepared for the actual date when the property goes 100% smoke-free indoors. And then of course, remove ashtrays, remove those triggers, just put them in other places and clean up littered butts because the property is going to look beautiful without all of the cigarette butts littered. And then celebrate your implementation. Go ahead and hold a party with food, music, and cake. Any excuse for cake is a good excuse. Offer incentives like a grocery gift card if people want to try and quit smoking. And just keep the message really positive and upbeat, which then lends itself to the whole tone. After the implementation date, okay, this is when we enforce the policy. And these are those great signs that Shelby showed us. And this is where, you can now advertise your smoke-free policy and listings, because we know people overwhelmingly want smoke-free housing. And as new residents come in, you can let them know what to expect and to educate these new residents and sign smoke-free leases with them. Now, enforcing the policy, is typically just one of those things that's enforced in the same manner as other things like loud noises, loud music, dogs, and burning toast, whatever it is, all the other building rules there are. This policy is enforced in the same ways, but Susan will talk a little bit more about this. And of course, we know universally, most people follow the rules if they understand the reasons for the policy. Like, this is about health. This is about keeping all the children and all the elderly, all those with health issues, healthy in their homes. And, talk a little bit more about the reasons for the policy and let folks know what's expected of them so that they'll see clear signage and have those triggers and reminders that'll help them comply easily with the policy. And then overall, just set a whole expectation of compliance. And I especially like it, to be thanked, and everybody likes to be thanked for their cooperation and help. And so this is the time to do that. When it comes to enforcement, we have this general rule of a graduated enforcement framework. So the first thing is a verbal warning. When you see someone smoking indoors, they get a verbal warning and hopefully a referral to cessation. For the second time that same person has violated the policy, then they get their first written warning in a cessation referral. The third time, maybe a second written warning in a cessation referral. And the fourth time is when they get the 30-day notice of lease termination. Now, you don't have to go by this general framework, do what makes best sense for your property. If possible, it's great to tap into Sophia and her team there and add a referral to resident services or community partners for support, and they can help you also develop a plan for following the policy. Lease termination, especially in these days, and maybe Jeff can talk to this too later, is that lease termination should only ever be the last resort. Now, when it comes to documentation, we want to follow through really quickly with all violation complaints. And this just sets up the norm that if there are complaints, people know that you're going to be taking it seriously. We want to document each reported violation. And here's a sample from Smoke-Free Maine, the state of Maine Smoke-Free Housing Coalition. You don't have to use this. Maybe Sophia's team can help you work up a document. But you really want to document evidence of each violation and then save that in your resident file and send a copy to the resident and do a form that makes sense for you. Now, what is evidence? Well, okay, we see a person, it's pretty obvious, isn't it? We see a person smoke where they're not allowed to, or we see cigarette butts in the property, or used ashtrays, or you smell smoke in a unit. You see burn marks, that would be something, or smoke damage, and even reports from neighbors about seeing or smelling smoke at certain times and dates. We'll say a little bit more about that next. But reports from your staff and observations that they see are also important. So any of these could be evidence. If you want to make smelling smoke as something that's not evidence, then you would rely heavily on the other pieces there. So more enforcement ideas are when you first go smoke-free to have more frequent unit inspections for people who might be suspected of violating that policy. Do a knock and talk where you just chat at the doorway. You don't have to physically go in, and then just discuss the complaints Note what you see and smell, and then document that visit. And send a letter after inspection that talks about the next steps and, of course, the consequences, so that people have a clear understanding about what the consequences are. Now, I love this because it talks about the role of the community, the residents, and how everybody can support this rule, this policy. So tell the residents how to anonymously report a complaint. And maybe Susan could talk about that for a minute. Residents can keep a written log of dates, times, location, all to demonstrate this pattern. And then residents can remind each other where they can go to smoke. Do this in a real careful, gentle, positive sort of way. And then residents will speak up, of course, if they feel supported by management. Now, after the first year, it's great to consider lessons learned, what you've learned about this whole first year of being a smoke-free property. And I really like seeing these surveys of residents after a year of this policy to get their thoughts on it, and what they appreciated about it, what would help it be more accepted. And then do a little budget, a little count of your cleaning costs, how much money you've saved in turnover time, and how much money you've saved in maintenance too. And then, of course, thank the residents in this celebration, and have a celebration, have more cake. This is a great time to celebrate all that hard work you've gone through. So now I'm going to stop the share and pass it over to the amazing Susan to talk about what she'd like to share for us.
Sure. So this is the biggest piece, is the enforcement piece that I've had to deal with in my position, my current position at the Lincoln Housing Authority. So I oversee 3 of our senior high rises that have been smoke-free for a number of years. And so my first introduction was probably 2 months into my new position. We got a report that we had a smoker from other residents that were smelling smoke quite often. And the resident services specialist, who is staff in our building, had been working with this person as well. And so when we do get complaints from other residents, we allow them to remain anonymous. We don't let the person that we're talking to know. We just let them know that we've had a complaint. We don't even necessarily will say it's from a neighbor or another resident. It could be from another staff. It could be from whoever. But we just let them know that we have a complaint. Our goal really is to keep people housed. I mean, we're working with seniors that are low income, and we, for my program, and we really want to keep them housed, but we also know that we're looking out for the whole building in general. And so if someone is smoking in there, we have to take everybody else's health and safety into consideration there. So our goal when we find out someone is smoking is to have that verbal conversation with them at first, and really let them know that, this is a non-smoking unit. This is where you can smoke. Here's the expectations. And then if we have another complaint, or we suspect that there's more smoking, we will go ahead and do a written warning. And then I typically move on from the written warning to then, if I have valid evidence that they're continuing to smoke after that, we move on to a 30-day notice, which gives them 14 days to get their acts together, stop smoking, or they'll need to leave their residence in 30 days. And when we do suspect that they're smoking, we pull I think I've talked about this in the past, but we pull the filter for the unit immediately after we've had that conversation with them, and they've either told us they're not smoking or they're going to stop smoking. So we put a new filter in, and that's one way that we use for evidence. I typically, if it's me or my staff, when we go to the door to talk to somebody, first thing I typically ask is, hey, can I come in? And I've not yet had somebody tell me that I can't come into their unit. I suspect that will happen or can happen, but typically I can come into their unit, and I can really then smell if the smoke is in the unit, or I can see if there's cigarette butts or ashtrays in there. If they deny that they're smoking, I will say, well, do you mind if I look around? Then that helps me, verify that you're not smoking. And typically, again, they say, yeah, you can look around. But if they don't, I mean, you can base that off of documentation that you do, like Shar said, of just making sure to document each incident, a report that you have of people smelling smoke in the building, when they've smelled smoke, what you've done to follow up with that, those types of things. What I've really noticed since we've been smoke-free for a number of years in our buildings, what I've really noticed is our residents that have been there a long time, they are typically pretty compliant with the policy. What we find is that new residents that move in, that even though they've been told and we've talked about that it's smoke-free, those are typically the ones that we find are the people that are violating the smoke-free policy. And I don't know if they just didn't take it seriously when they moved in, or it just became too, they thought they could do it and it became too much for them. And so that's just where that education piece comes in. And I do notice that when the weather gets colder, like it is now, although I'm going to knock on wood right now because I haven't had any complaints lately, I will have cursed myself and I will now have some complaints coming in today. But that is typically when we see colder weather or bad weather, that is typically when we do potentially see some incidents of the lease violation. So, and then I'll just speak really, I know we want to leave some time for questions, but I'll just speak quickly about the moratorium on evictions that there's going on right now. And that is really only for non-payment of rent. And we unfortunately have had to move a lease termination. We did a lease termination. They did not move out, and we had to go for eviction in court. And we did not have a problem with this. The judge even said the moratorium's only for non-payment of rent. This is for a lease violation. And so we were able to move forward with that eviction in court. So there hasn't been any issues that we have run across yet enforcing this policy.
Great, thank you for sharing, Susan. Jeff, did you want to add anything real quick before we start taking questions?
Well, one thing I'll add just real quick is having done this a long time, having worked with a lot of public housing authorities and market-based housing landlords and property managers in implementing policy, I won't say it's 100%, but the vast majority, the fears of enforcement are much greater than what the reality is once the policy goes into place. It's good to be prepared. You want to know what you're going to do if there are violations, but I think that it's not nearly as bad as what people think it's going to be, has been the thing that I hear most often after someone has a policy in place. That doesn't mean don't be ready. That doesn't, and it also means that people looking back and saying, I'm sure glad we really took our time with it. It doesn't have to be something that happens quickly. Take the time to educate, take the time to get people ready, and that ramping up will go a long ways to having high compliance once that policy is in place.
All right,
I'll just add,
yeah. Okay,
sorry, I'll just add into that once you do, if you do end up having a violation, a lease violation, word spreads pretty quickly in your buildings. And so sometimes when others see that there's somebody was asked to leave or their lease was terminated, it does help with compliance.
All right, thanks for sharing that, Susan, definitely. I think this means that we're at the point where we're able to open up the floor for questions. So place your questions in the chat, or if you want to take yourself off mute and ask a question, go ahead and do that. I have a couple that came in during registration that we'll just kind of kick off this conversation with. One of them was, are there any legal repercussions for violating the smoke-free policy? Jeff, do you want to jump on that one?
Yeah, I can jump in on that one. I think that it's important to note that when you're setting the policy, it'll be for the individual units, the hallways, common areas, lobby, laundry room, community hall center, whatever it might be. Any of those places that are common areas, that are not private residences, that are part of the residence, that are inside, are covered by the Nebraska Clean Indoor Air Act. So those would be violations of the state statute if those are going on in those common places. So that would be where the potential legal infraction would come in if there's folks that see a violation, there's ways to report that, and that inspection will take place. And so, and that's also incumbent on the property owner themselves too, to make sure that that's being followed in those common areas as well. And there's that can include putting up some signage around that as well.
Great, thank you. Let's see, there's another question that came in on registration, which I think you touched on, Shar, but maybe if we want to give a little bit more specific example about how you prove that someone is smoking inside when they should not be. I did also have a call come in with a residential complaint to the house or to the health department, where the complaint was of third-hand smoking is basically what the property manager ended up saying, that the person would go outside and like chain smoke for 30 minutes and then come in, which obviously isn't a violation, but I guess could you kind of tag team, how can you prove that they're smoking, and then what's a way to address that if there's just that heavy residue on someone?
Yeah, let me take the last one and probably punt the first one over to Susan a little bit more, but although I do have lots of examples. The third-hand smoke one, you know, sometimes it's just an education thing where people don't, you know, when they're around something all the time, they don't really smell it anymore, and yet it's really intense. So, you know, what would be great is if there's resident meetings to have, you know, to invite Sophia and her team to come and to talk about third-hand smoke and what it means and what it does and how it can be such a dangerous thing for people, and especially babies, to be around in. And, you know, so if we could just raise the education level of that, that would be great. Something that I've done is I've talked to other smokers too, and I've asked them, how do you deal with third-hand smoke? You know, what do you do differently so that you don't bring all that in? And they say, well, here's the place where I stopped smoking, you know, yards down, so that I've got plenty of space to get most of the fumes off of me. Or, and this one I love, is I have a smoking jacket. You know, those old smoking jackets? I just have a jacket that I throw on so that I don't then carry all of that third-hand smoke on my clothes in, and I just leave the jacket in my car or whatever it is. So sometimes getting smokers to help brainstorm around that is great. Susan, do you want to talk a little bit about how to identify issues when it comes to reporting a violation?
Sure. I don't know if I have really any good suggestions for this, because if it's really not a lease violation, I mean, all we really can do is kind of what you suggested, Shar, is just to have a conversation with that tenant and kind of problem solve some things with them. And we do have, in the buildings I oversee, we do have resident meetings. And so sometimes that's a time that comes up, and you try to hold that conversation as delicately as you can, so they're not trying to point fingers at a certain person during a huge meeting like that. But really, we just try to have one-on-one. I mean, there's uncomfortable conversations with our seniors that we work with that we have quite often, sometimes about hygiene, sometimes about, you know, cleanliness of apartments, those types of things. So we just try to deal with it as delicately as we can. If it's not a lease violation, there's not a lot you can do other than just kind of educating them and seeing if there's any assistance that you can offer them.
Right, right. I would also throw in that, you know, for those knock and talk kind of times, that's where, just like Susan was saying, you know, to ask to be let in, to take a look around. If you see ashtrays full of cigarette butts, there you have it. Or if you see a pile of cigarette butts out on the balcony or in the ground next to their outdoor door space, you know, well, there you have it too. And sometimes we just take pictures, or sometimes we just document this huge amount of litter in a certain spot, and, you know, track it and see what happens. So there's a lot of different things you can do to track these violations.
Okay, thanks for sharing that. I'm going to kind of just add on a thought from a previous webinar. Susan, have you ever had an experience going to court for one of these eviction or lease terminations where smoke was the only evidence, like the smell of smoke and not visual evidence?
So I have, but I'll be honest, I haven't had anyone yet that has shown up to their court date to fight that charge. So we have not had to present evidence, but we've been prepared. We've had photos we've had the actual filters from the unit. We've had photos from anything that we may have found as evidence. If they've done an inspection and it's the inspection person that has found cigarette butts, those types of things. And then we've also had other residents that were willing to come in and be witnesses if need be. But again, fortunately, we've not had to do, but we're prepared each time in case we do.
Great, thank you for sharing. That's very helpful. I think we have one last question here before we wrap it up for today. But I guess it might be a little bit vague. How do you tell the difference between if there's a better policy or if you should adjust your current policy? Do you just abandon it and get a new one? Do you adjust the one that you have? How do you make that determination?
Sometimes I just check to see if all the new things, you know, the tobacco industry keeps coming out with new things because they want people to be addicted. So if e-cigarettes are part of your policy already, then great. You know, but yeah, I'd love to hear what Susan has to say.
Well, I haven't had to adjust our policy yet, but what we kind of do with anything is just kind of monitor how things are going. If we feel like things are going well, you know, it's constant communication with staff that's working in those buildings and at the resident meetings. If residents seem to be happy and satisfied with how things are going, and staff seems to be, we feel pretty confident that things are going well. If we start getting complaints from residents that this doesn't seem to be working, or we're noticing a lot of this or that, then that's when we would relook at things and kind of sit down and have a conversation with staff and residents to see what changes we might want to implement to make satisfaction, I guess, at a high level.
Great, thank you. Oh yeah.
I'll add to that just a little bit as far as you're going to be a good judge of how the market's responding to it as well. Are you getting positive feedback from folks when they come in and ask about your apartment community, and when they find out that there's no smoking allowed, do they react positively or negatively, or does that chase people away or attract new renters to your properties? And so I think getting a feel for, we know from the data as far as what people say on surveys that it's very popular, that most people want to live in a smoke-free building, and may not always use that as a deciding point or as part of their looking, but it's definitely an amenity that they appreciate and enjoy for the most part. So you may have, your memory may be about that one single ornery, salty person about the policy, but it's also getting an idea of what the entirety of the residents think of it, and letting the market sort of dictate to you as well.
That's a great point, Jeff. Thank you for sharing that. Yeah, so I think we're at the end of our 30 minutes. I want to thank our panelists for their time these last few weeks preparing this information. It's been great, and we will have it available on our website and also on the ANRF landing page that's dedicated for this outreach opportunity. Also, you will be getting an evaluation email. Please just take a few minutes to answer it. We really appreciate the feedback as we plan more programming in the future. But thank you. Have a wonderful day and week, and stay warm.